So hello everyone, this is Ajay and it gives me an immense pleasure to inform all the people of Nagpur that Thyrocare Technologies Private Limited is coming into Nagpur and it's been inaugurated on 25th of May 2022 in Nagpur. And under the decentralization policy of Thyrocare Technologies Private Limited, they have started their lab over here in Nagpur. So you are the lucky one who can, encash the benefits or encash the facilities that have been provided by Thyrocare Technologies Private Limited, that too in Nagpur only. So Thyrocare Technology, it all started in the year 1996 with a single vision of Thyrocare testing, but over a period of time, it has spread globally and across India. So Thyrocare itself states the trust and the truth. So Thyrocare, it all started in 1996 with a vision of single testing, that is Thyrocare testing. But over a period of time, it has been spread across the globe, and it owns its CPL, ZPL, and RPL. So when it comes to RPL, Thyrocare has inaugurated its RPL in Nagpur on 25th of May 2020, that is today. So it's a very humble request to all the people of Nagpur, those who are looking for a treatment of thyroids, they can visit over here and they can get their things done over here at a one-stop solution. You will get each and everything over here in Thyrocare Technologies Private Limited. So this is all about Thyrocare. Thank you. Present out here in this remarkable morning for Thyrocare in Nagpur. It gives me immense pleasure to welcome each one of you, every one of you in this beautiful morning, in this beautiful occasion over here. And a big thanks to all of you that you have spared your valuable time to be a part of this mesmerizing event of Thyrocare in Nagpur, which is the RPL launch in Nagpur, 17th RPL of Thyrocare Technologies Private Limited in Nagpur. So once again, a warm welcome to every one of you. Special welcome to our honorable guest and CFO sir of Thyrocare Technologies Private Limited. So this is all about this beautiful morning. So with all the permissions, we'd like to start this beautiful morning. Moving ahead, firstly I request CFO of Thyrocare Technologies Private Limited, Mr. Sachin Salviji, to please welcome our chief guest for today, Dr. Ajay Kaduskar, by offering them a plant sampling and a token of love and a bouquet. As it has been said, gratitude is the best attitude. So considering the same, we are welcoming our guest with an open heart. So I request everyone, please can I have a huge round of applause. Thank you so much, sir, Dr. Ajay Kaluskar, sir, for your valuable time over here in this remarkable 17th RPL launch of Thyrocare Technologies Private Limited in Nagpur. So, moving ahead, I would like to give a short brief about the journey of Thyrocare, how it all started and like where it is standing today. It all started in 1996, started with a single focus, thyroid testing using a Nobel Prize-winning technology. Moving ahead in the year 2000, first automation installed. Integrated air cargo logistics system into the system. Web server based reporting nationwide. It all started in 2000. Moving ahead in 2001, it got accredited by ISO. That was again a big achievement. Moving ahead in year 2002, launched thyroid testing by CLIA. That was again a remarkable move. Again in 2003 introduced photometry and nephelometry platform, which was again a remarkable sign for Thyrocare Technologies Private Limited. In year 2004 introduced unique barcoding system nationwide, first ever in diagnostic industry. That was a remarkable benchmark which has been created by Thyrocare Technologies Private Limited. And along with the year, things have been growing like from India to it has been gone to globe and the journey was remarkable. So this is all about today. So we all are here for the inauguration of 17th RPL of Thyrocare Technologies Private Limited. So further not taking your much time, I invite Mr. Sachin Salveji to brief us about the Thyrocare journey to present the significance of this 17th RPL launch in Nagpur. Ladies and gents, can you have a huge round of applause for...
Good morning. And thank you very much for being here and being a part of this RPL launch. As just now mentioned, we have started 17th Regional Processing Laboratory in Nagpur. We have started our journey in 1996 with a small laboratory, and as of now, we are one of the nation's biggest pathology laboratory. We are listed on National Stock Exchange, we are listed on Bombay Stock Exchange. We are having a centralized processing laboratory in Bombay. We are having zonal processing laboratory in Delhi. We are having zonal processing laboratory in Bangalore, Kolkata. And we are having regional processing laboratories at various parts of the country, including as far as concerned is in Bhubaneswar. We are having in Kochi. We are having in Bangalore. We are having laboratory in Lucknow and Patna also. So various parts of the country. So it is not that we are catering only a small part of a country. We are catering the entire nation as of now. Daily we are processing about 350,000 investigations. That is coming from about 50,000 odd samples. The COVID RT-PCR test when COVID came in 2020. We were not doing infectious diseases tests at that moment in time. We were very small at that point in time in that segment. Our capability was only to process 400 tests a night, which has been significantly improved over the period of time. As of now, when I'm talking, we can process about 40,000 tests, 40,000 COVID RT-PCR tests a night. That is huge. No one has in this country as of now. And that too from 3 laboratories, that is in centralized processing laboratory at Navi Mumbai, then Bangalore and Delhi. During COVID time also, we have processed samples for National Health Mission, Government of Maharashtra, we have processed for Government of Jharkhand, we have processed for Government of Uttarakhand, we have processed for Government of Jammu and Kashmir. It is not a single state which has come back to us for a request to process their COVID RT-PCR samples. Good thing is that COVID has gone. Touch wood, it shall not come back. But that itself says that the pathology business has come back to a normalcy. We are seeing a good trend. We are seeing a good number of samples growing. Nagpur, the orange city, hasn't been a part of our journey so far, and we were thinking of placing our laboratory in Nagpur for some time during the COVID period. That project to a certain extent got delayed, but more importantly, we are on to it. And I again thank you all for being a part of this venue or being part of this occasion and taking out your time to be there. Thank you, Dr. Ajay, again for being there with us. Thank you very much.
About the Thyrocare Technologies Private Limited. Moving ahead, we are having the guest of honor today with us, Dr. Ajay Karuskar. So before calling them on stage to give a formal speech, I would like to give a short brief about Dr. Ajay Karuskar. He is Director and Consulting Cardio-Diabetologist, Niramai Diabetes and Heart Care Center, Niramai DHCC. He is the Chairman of Association of Physicians of India, Vidarbha Chapter. He is the ex-president of Diabetic Association of India, Nagpur. He started Niramai DHCC in year 2010 in Nagpur, and the center is registered under Hospital Board of India. The center has patients visiting from a radius of 400 km. Though its trust, Dr. V.S. Karuskar Memorial Foundation, Niramai Diabetes Mobile Unit visiting the remote suburbs to manage diabetes at their doorstep of the underprivileged in the society. He completed his medical studies from Government Medical College, Nagpur and LTMMC, Sion, Mumbai. So it has been a remarkable journey of Dr. Ajay Karuskar. So they are here with us as a chief guest on the 17th RPL launch of Thyrocare Technologies Private Limited. So moving ahead, I request Dr. Ajay Karuskar, sir. So please, we would like to hear a few words from you. Thank you so much.
Dear Salviji, Girish, all of you present here. It's a pleasure being here with all of you on the occasion of the inauguration of the 17th, as I hear, if I am correct, Regional Processing Lab of Thyrocare at Nagpur. And just like when he introduced me, I am a born and brought up Nagpurian. Although I have done my post-graduation in Mumbai, I am a Nagpurian at heart. So as a Nagpurian, I am really happy that the reference laboratory is opening in Nagpur, for the reason that it is going to help the patients of our area. I am a treating diabetologist, and as a diabetologist, what I feel as a doctor, and when I look at it from the patient's perspective, the turnaround time, that is the time to get the report of a sample, which is known as the turnaround time, is especially important. What this reference lab is going to do for our patients is that the turnaround time for the samples is going to reduce. Patients are going to get the reports as quickly as possible, and this in turn is going to save their time. This is going to help in better decision making for the treating doctors. Nagpur is the gateway to central India. Although we are a part of Maharashtra, we are a gateway to central India, and we, just like you mentioned, we, not just me, everybody of the treating doctors in Nagpur gets patients from a radius of around 300-400 kilometers. So when patients travel 300-400 kilometers to meet you, they need reports, they have taken leaves. We need to think it from the patient's point of view. They have taken leaves from their works or offices. They have traveled so much. So it's our duty that we give them quality reports and we give them quickly. So quality and the turnaround time of reports is very, very, very important, which is going to be helped by this reference laboratory. Earlier, there were certain samples like fasting C-peptide, which we had to send to Mumbai, and there was no other option than asking the patient to again contact after 2 days. Probably this would be a thing of the past with the opening of the reference laboratory. And ultimately, whatever just now I was discussing with Saviji, in any branch of medicine, it is the patient which should be at the center of everything. Whatever, whether me or the technicians or the Thyrocare laboratories or any other laboratory are there because of the patients. So whatever is good for the patient, whatever is for the benefit of the patient, that should be the center of all the decision making. And herein lies the role of such good quality reference labs which would provide quality diagnostic services at an affordable price with a less turnaround time, which would help in better decision making for the doctors, which would translate into better treatment for the patients. So I would like to congratulate and I would like to thank on behalf of Nagpurians for this reference lab in Nagpur. One more thing, like all the technicians here and all the front office staff, they are the backbone of any institute, any clinic or any hospital. They are the face of any clinic or hospital or any diagnostic lab. So their sincerity, their pursuit of quality is what ultimately determines the quality of the results. So they have a great responsibility on their shoulders. And when, since just now Saviji was saying that Thyrocare is transforming into a B2C model where you will be having customers walking in. So just a bit of advice for all of you, when anyone walks into your clinic or whenever he walks into your laboratory, think of him as your relative or as your brother, sister or your parent and treat them the same way, because healthcare is different from other. This is not like we have an Empress Mall across the street. This is not like any other corporate thing. Here the patient or the human values, human emotions have got utmost importance. So you being the face of the laboratory here, it's all on your shoulders how patients take it and how patients look at any diagnostic modality here. I wish Thyrocare Reference Laboratory in Nagpur all the best, and I thank all of you for inviting me here for this inauguration ceremony. Thank you very much.
Further moving ahead, would like to add few points more over here. For Thyrocare Limited is a pioneer of affordable, reliable, fast-paced and most trusted laboratory in India and across the globe. Thyrocare now have expanded menu of more than 700 plus test packages and more than 80 plus odd profiles. These RPL launch represent the growth of our comprehensive diagnostic services across India. The uniqueness of Thyrocare is its efforts to innovate and remain at par with global standard to provide the best services at the most cost-effective prices. Moving ahead, I would like to add to carry on Thyrocare legacy of 25 years and assure cost-effective healthcare for one and all, to keep up with the mission to overcome an intangible and challenging aspect of diagnosis. Thyrocare will be expanding all the more. So a big round of applause for Thyrocare Technologies Private Limited over here. Again, to present the gratitude, again I request none other than Mr. Sachin Salviji to present a memento to Dr. Ajay Kaluskar sir for their valuable presence over here and their quality time spending.
Yes, sir.
We are really pleased to present you with a token of love over here on the behalf of Thyrocare Technologies Private Limited. So, at last but not the least, I would like to thank each one of you for being over here in this remarkable morning in the history of Thyrocare Technologies Private Limited. Being an anchor, I extend my warm thanks to each one of you for being over here in this morning, in this beautiful inaugural ceremony of 17th RPL launch of Thyrocare Technologies Private Limited. Thank you so much. I request all of you to please have a refreshment which has been planned up a day outside. Thank you so much for valuable presence. Thank you so much. Have a great day ahead. Thank you.